Good evening, I'm Viola Konevsky, Secretary of the NYSOA. It's that time of year again. Time for the NYSOA Leadership Update. The leaves are brilliant and the air is chill, much like your elected officers who met this weekend in Saratoga Springs. This is a very condensed synopsis of what transpired. But first, a little message from our sponsors. What are partners? Corporate sponsors that support our practices and our state association. Alcon. Merge with Novartis and you will have one rep for all your vision needs. Have an online retailer competing unfairly with your practice? Tell your rep. Alcon is actively investigating unfair competition and deceptive pricing practices, shutting these retailers down. J&J is rolling out AccuView Oasis with transitions in partnership with Essilor. Demos and trials will be available at trade shows. If you're interested in the new LipiFlow technology, contact your local society president and they will put you in touch for a demo in your office. Read exhibitions. Javits Center has meeting space available during Expo for use by local societies and their members. ABB. Don't forget to use their retail price monitor and business review to keep your business on track. Advance Optical. Advance Optical has spent 90 years in knowledgeable, reliable, and courteous service of ODs. I like it. Conan Medical. This 7-year-old upstart that you know and love for their awesome specular microscopes is rolling out some amazing handheld visual function diagnostic devices. Most exciting of all, an objective full field analyzer, coming to a practice near you next year. Vision Source. Focused on linking primary care ODs to PCPs, this company has many resources available to private practitioners. TLC performs 2 to 3 million refractive surgery procedures a year in over 80 centers across the country. These laser centers can be made available for wet labs to interested ODs. And now back to our regularly scheduled programming. Capitol Hill Management Services. Our new management team has rolled out a strategic plan for the NYSOA and the entire board is jazzed. Stay tuned for a new website, new member tools, and best of all, an exciting State Association CE meeting. United Possibilities from the AOA. Remember this marketing campaign we signed up for last year? Our goal was to recruit 32 members, but of course, Marina Sue and her young advocates have exceeded expectations and recruited 38 because they're amazing. School Vision Health Month. In cooperation with VSP and some amazing volunteer ODs, 5 school districts received much-needed eye care and eyewear for their little ones. Thank you to our NYSOA member volunteers, Dawn Shivers, Robert Fox, Lauren Pearson, Justin Smith, Victor Vuong, Kimberly Wattis, and Paul Westfall. We continue to expand this amazing program to include more schools and more doctors each year. Legislative update. The OD-MD bill, allowing different licenses to co-own practices as equal partners, is on the agenda. A new insurance law provision is being drafted by our council, clarifying that there cannot be discrimination as to what services can be provided by optometry versus ophthalmology, prohibiting current clauses that allow vision plans to keep optometrists from participating on associated healthcare insurance panels, prohibiting vision plans from forcing discounts on non-covered services. Disruptive technology. As you know, Century 21 has Vision Express kiosks being operated by unlicensed individuals. Official complaints have been filed with the State Board, Office of the Professions, and Office of Professional Medical Conduct. Our attorneys are now in the process of finding individuals writing prescriptions and bringing them to task. Third-party update. The brilliant and personable Dr. Soden brought the following news. 3 important updates were released last week from CMS. Don't fall asleep, please. Did you know that 11,000 people become Medicare eligible each day? This is important. New guidelines were released for an implementation date of 2021. Responding to multiple complaints from physicians, CMS published a Patients Over Paperwork initiative. The amount of documentation required to support billing and coding will be significantly reduced. Woohoo! Ancillary staff will be allowed to gather much of this documentation. Yay! Reimbursement for many procedure codes will be reduced. Well, it can't all be roses and clovers, can it now? Most changes will affect the 9900 codes. A new Level 1, blended Level 234, and a Level 5 payment code will replace the current coding system. One will be able to use the old 1997 guidelines and codes based on medical decision-making rather than history, and or be able to use time as the sole determinant of coding level. Proposed new single rate reimbursement is $135 or $93, new or established, for Level 234 visits, and there is a proposed add-on for extended time visits and extended complexity visits. Doctors who currently bill mostly 99212 and 99213 codes will likely see a slight increase in payments, while doctors who use mostly 99214 codes will see a significant drop. 92 codes are not affected as of yet. The MIPS program has made several changes. If you were not able to participate before, starting in 2019, a third qualifying category will be added. If you provide more than 200 services per year, you can voluntarily opt in even if you don't have $90,000 in billing or see more than 200 Medicare patients per year. One can participate even if no EHR is being used, as meaningful use only comprises 15% of the requirement. CMS has hired an independent firm to help doctors participate in this process. Dr. Matt Allen has used their services and has found them to be particularly helpful. What about the orals bill, you say? Jim and Jim, our trusty legal advisors, say, "We're so close." Are they on drugs? No, because we still don't have the right to prescribe them. So what gives? They are pressuring Speaker Heastie to bring the bill to the floor for a vote and adding bill sponsors. We have 91. This is a record. Lobby days in May, and hope springs eternal. Here is your hard-working trustee, Dr. Jenna Salner, drinking from the spring of eternal hope.
That's the face.
And here are some photos from the weekend. Serious folks doing some serious business. The youthful contingent up to no good with our executive director after hours. Michael G. Jr., future OD, car shopping. Like I said, hope springs eternal. And here's the whole gang at the end of a long weekend. None the worse for wear and all jazzed up for an amazing new year. And that's the way it is.